the ribbon cutting just a few weeks back at Titusville Area Hospital, their new freshly renovated oncology department. Joining us this morning is Kelly Clark and Kai Skinner. Good morning. Good to see you this morning.
Good to see you, Luke.
Congratulations. What an event.
It was a great event. We had been working on the oncology project for quite a while and actually just had our first patients come in on May 6th and opened up the department. It was a big project, but it turned out so gorgeous. Thank you for everyone that came to our open house. We had about 100 people there to see the new space.
That's wonderful. And folks who have contributed, folks who certainly have used the hospital, maybe a family member just going through treatment. You know, the one thing I heard from a couple people was how nice it is to have a hospital that invests in this kind of thing, and just keeping that healthcare right here at home is outstanding. And, you know, you see a little tear coming out of their eyes, and just the impact that has is incredible.
Right. And, you know, the peace of mind that you're not going to have to drive an hour for all of your treatments and you can stay close to home. Our doctor, Dr. Young, he was the one cutting the ribbon. He's great, has made a difference in so many lives, especially locally here.
And listening to his speech was incredible because it was kind of about like a pleasant surprise, like just how much he loves this area and his patients and all of that is a great story.
Yes, it is. Talking about how Titusville was the high point of his career, and he hopes to stay here for as long as he can. Yeah. So that meant a lot to us.
That's wonderful. Well, congratulations. What a great event. And the other thing that was awesome to hear, how part of that wing had like a dirt floor or was used for storage.
Yes, so for the longest time, forever, actually until recently, that was used as storage. It was a shell space. It housed a lot of HVAC system. We stored a lot of unused office equipment in there. If we needed a desk or something, we'd go down there. And yes, it was a gravel floor and not much to look at, no walls. Everything was pretty bleak, so they cleared all of that out, and the transformation was incredible.
Wow. Congratulations.
Thank you.
That's awesome. Well, there's a lot going on.
So much going on.
And you brought in a special guest.
Yes. Kai is our new physical therapist at our outpatient physical therapy on Central Avenue. So welcome, Kai.
Thank you.
He brings a lot of really great experience with him, and we're really glad to have him.
Kai, welcome.
Thank you.
You're certainly not new to the community.
No.
Tell us a little bit about yourself.
Yeah, so like Luke said, my name's Kai. I grew up here. I went to school at Titusville High School and then spent 4 years at Westminster College, getting an undergraduate degree down there. Played basketball, continued on up. And then after Westminster, I went down to the University of Pittsburgh, spent 2.5 years there getting my doctorate in physical therapy. Did some clinical work at both UPMC and some private practices down there. Spent a lot of time at the Rooney Sports Complex and then the Lemieux Sports Complex, seeing a bunch of different things. So it was a great time for us.
When did you know that this is the direction that you wanted to go for a career?
Yeah, so growing up, I spent a lot of time at the clinic I work at now, just growing up with the former owner and his kid. I spent some time in there, and then this opportunity kind of presented itself as I was finishing up school, and I thought it'd be a great way to come back to the community that I grew up in, be around family, and just it's home, so there's nothing better than home.
Yeah, so was that something you knew that you wanted to do, is always come back, or did you kind of explore other things, and then, you know, the more you kind of thought about it, the more this made sense to you?
Yeah, I think getting older was just a realization that I wanted to be back closer to family, as my wife and I decided to start a family and things like that, just being close to grandparents. And then I really like giving back to the community that helped kind of build us up. Everybody was super supportive growing up and all that good stuff.
It's so weird to hear you say that, because it just seemed like yesterday you were on the high school basketball team.
Yeah.
I mean, it's crazy.
Time really does fly.
Not for us, Kelly, of course, but
No.
for everybody around us.
Yeah.
No, what a great story and great addition to the family, huh?
Yes, definitely. We love it when kids come back to where they grew up. they can make a lot of really great connections and relate to patients on so many different levels, especially him being in PT and, having the kiddos that are playing sports now come in. He has those same experiences, possibly some of the same coaches, some of the same teachers. So it's just a really great dynamic that he can bring to the table.
Well, speaking of that dynamic, Kai, I know a lot changed from when I played high school sports to covering high school sports. What has changed from when you played to now in that short span?
Yeah, I mean, everything's a lot different. I mean, just looking at these young individuals and trying to think back to when I was playing, the games just seem a lot different now. There's different paces of play. There's different dynamics, different strategies being used across all the sports. I mean, I was the big basketball player, and I look at that, and it hasn't changed a whole heck of a lot because it's the same coach. But looking at our football program, we've seen a big shift there with new coaching and a lot more kids invested, and it seems like our younger generation is really kind of buying back into the sports in Titusville, which is great to see. We had a couple down years where we just weren't getting the participation. So I think we have a lot of coaches that are in place now that are really kind of promoting the youth, and I think that's really important as we start to feed into our middle school and high school programs. So just seeing that happen in Titusville is really encouraging.
So talk about the level of care, though, when it comes to keeping athletes safe, or if they are injured, making sure that they're taken care of in the appropriate manner. Obviously, concussions have been a big conversation. Talk a little bit about just that aspect of it.
Sure, yeah. So first and foremost is our patients' safety, right? But we also want to get them back to their sport, get them back to the activities that they're really involved in and love to do. That's kind of our goal as therapists here, not to hold them back, but to kind of just direct their care and get them back to what they love doing. You mentioned the concussions, which is something that I have a little bit more experience in just based on my clinical rotation. I got to work under a couple of very well-known concussion clinicalists and just gained valuable experience, but it's not necessarily something that all physical therapists do. It's a relatively new research that is linking therapy to better outcomes for concussions. So basically, if we're looking at a young athlete that has a concussion, gets diagnosed with a concussion, and we want to make sure that they're safe enough to return back to their sport. So we kind of, basically the continuum of care would be seeing your doctor first, recognizing that, hey, there is a concussion, and then them getting them set up with a therapist to kind of direct their care from there. So once we see them in our clinic, we do our evaluation, kind of see where they're at in the management of their concussion, and then we can kind of formulate a plan from there, and then just start this gradual return to sport, and just make sure they're safe in doing so, getting back.
What has changed in that department since you played? Has a lot changed? Do you find that there's more information available now, or is it still something that's sort of in its infancy and there's still a lot more to research?
Yeah, and I think you can argue both aspects of that, where we're still in its infancy in concussion management. I mean, in medical research, you're looking at a good 25 years before you have the complete standard of care. This is what you do every time. And concussion research is 10 to 15 really, and it's evolving every day. So it used to be with concussion management, even when I played, we kind of avoided symptoms. We shut down. And then in present day, we use more of an active approach to concussion management, where we don't want you to go sit in a dark room with your sunglasses on and try and avoid these symptoms. It's really good for our brain to have this extra high stimulus. I kind of liken it to a weak muscle sometimes, where if you don't do an exercise for your legs and you go into the weight room and you start squatting really heavy, your legs are sore because they haven't been used. Same thing kind of happens with these systems that are responsible for things like balance and dizziness in your brain. If you get a concussion and you go shut down and don't use these systems, then you come back and try and do these high-level sports or other recreational activities, and the systems are weak, so we have to really strengthen them with therapy. And we use exercises, we use some visual, like ocular motor movements in the eyes to really target and address that.
Is there a challenge where you have people like me grew up with the, okay, suck it up, get back out there and play mentality, to the reality of, hey, let's make sure everybody's safe first before, and listen, we want them back out on the field too, but we want to make sure that they're safe doing that, and we want to make sure that they're able to do it for years to come instead of just this, to finish the game type of thing.
Sure, yeah, no, you definitely run into that where kids really want to push their timeline a little bit, and we have to pull in the reins a little bit. But for the most part, I think that kids really just are starting to recognize. It's in the news more. You see it on ESPN, you see it on the news, some of these football players that have dealt with concussions and things like that. So I think the stigma around concussions is improving a little bit. Like, hey, there are resources for you to use. And I think that even our young individuals are a little bit more in tune with, hey, let's go get some management so I can get back to doing my sport safely. I just think talking about it in the past 5 years has really helped that.
I think to a degree where you hear about it in maybe sports you wouldn't think about.
Sure.
Obviously, football, soccer, where you're using your head, but basketball, like golf, people have had mishaps on the golf
Sure.
course, and then that applies not just to students, but folks in the workforce. Maybe you're working around the house, maybe you're doing something at work and something happens.
Yeah.
So again, to transfer from the athletic side of it to the adult side, there's probably a list of things that folks could come in and see you about relating to concussions.
Yeah, it's great that you mentioned that, because I would say in my practice I've probably seen more of your older adults rather than your athletes that are still maybe not acutely dealing with a concussion where they hit their head last week getting into their car or something like that.
Yeah.
But they did that a year ago, and they're still having some of these symptoms: dizziness, balance, headaches, foggy visions, things like that. And they're not really sure what it might have came from. But concussion symptoms can honestly last forever if they don't have the appropriate management. So I do think it's important that if you are dealing with some of these symptoms, and hey, maybe you're not sure why, or maybe listening to this, you're like, oh, I did hit my head a couple months ago or a year ago. Like, maybe it is time to find a doctor, a therapist to get in and see what we can do to manage these symptoms. It's called post-concussion syndrome. So if left untreated, these symptoms can last for a lifetime, really. So It's very interesting. But we usually do have pretty good results. I've seen people as old as their injury was 10 years ago. So it takes a little bit longer the longer you wait, sure, but that's with any injury. So it's been a really interesting avenue to explore over the past couple of years.
Well, and I'm sure it might take somebody a minute too to think, well, that was just a little bump on the head. I didn't think that had anything to do with it. But the reality is it could play an impact. So be mindful of that kind of stuff. Kelly, it sounds like another great addition again to the Titusville Area Hospital family.
Absolutely. We're really excited to offer concussion management now. Kai is definitely taking the lead on that initiative. If you are experiencing anything like what Kai is talking about, the best thing to do is talk to your PCP and get that referral to come and see us down at the PT office.
Excellent.
Yeah.
Well, while we're on the subject of other things with the hospital here, let's talk about what else is going on. There's a lot happening.
There is a lot happening. So we have another support group coming up. Amelia Finnere, our dietitian at the hospital, she is leading a eating disorder support group. They're meeting every month. This month they're meeting on the 23rd, which is coming up at 4 p.m. in the boardroom. So if you know anyone or have any interest in that, please attend. If you have any questions about it, you can call me directly at 827-1060. If you're not ready for a support group and want something that's a little more one-on-one, Amelia is also open to that. Definitely give us a call, and there's help out there. Just reach out.
All right. Excellent.
Yes.
These programs are always successful. There's a high demand for them.
Definitely. And we have so many different, doctors and specialists at our facility that are offering their time to get these community projects out there and get people involved in their own healthcare.
Excellent.
So it's great.
May 23rd at 4 p.m.
Yes.
Okay.
So something else big happening next week is our golf outing.
No, that's not. That can't be right. Is that right?
That's right.
That's next week?
It's 1 week away.
Wow.
May 22nd. We have a ton of teams. We filled up our teams very quickly. Yeah.
Congrats.
Thank you. Lots of local support, lots of sponsors. So thank you to everyone that is playing or sponsoring or has donated. I would like to give a shout out to some of our bigger supporters of our sponsors. USA Radiology, Meadville Medical Center, Oil Valley Internal Medicine, Highmark, the Titusville Area Hospital medical staff, Ari Johnson, and Quadex. I'd like to definitely thank those. Those were our top sponsors this year, so thank you so much. And there's so many others. We could be on here for a long time if I listed everyone. They will be available on our website and in our golf programs. So definitely thank you to everyone that's made this possible. It's going to be a great day.
And again, just knowing it supports the hospital and the great projects that are being done there. So, again, if the weather, it doesn't matter. That stuff doesn't, you're there to support the hospital and to have a great time.
Yes, and it's going to be good. We have a lot of raffle prizes, games, fun. It's going to be a good time. And
just let people know, this was, I think, me last year. So, I mean, just, again, anybody can golf. It's a great time. And it's a lot of fun, and so again, it doesn't really matter. I had shorter hair then or something, I don't know. But anyways, it's going to be a great time. That's next week already.
That's already.
It's incredible.
Yeah, it is, because I feel like we talk about it for 6 months out of the year. So after next month, I'm going to take a break, and then you're not going to hear about golf. But it seems like we never really stop with golf. It just keeps going. So that's what makes it such a good event, is the amount of planning and getting ready for it. So yes,
apologies to that man, I don't know who that is, but
yeah.
And it's something that I don't think people realize. It's sort of a year-round conversation because it is such a great fundraiser for the foundation. It does take a lot of time to pull it together, but it's a great outing, and congratulations. That's awesome. Wonderful.
Thank you.
And then the money is raised this year?
Yes, we'll go directly towards patient care services that we offer at the hospital. So every dollar always goes towards something that is patient driven. Like our oncology renovation. Before that, we got hospital beds. Before that, we put a new CT scanner in. Before that, we were working on ER. So those are just some of the projects that all of these monies go towards. Anything that the foundation raises goes directly towards patient care services. So.
Kai, I know you said it's nice to come home, but I'm sure just knowing that the hospital itself is doing projects like this, reinvesting, looking to bring in doctors that can provide the services needed. That had to have been another attraction for coming back.
Yeah, it was great. I mean, I remember the first time I came in, speaking with some of the upper management at the hospital and just going around on a tour. And it had been a while since I'd been in the hospital. I mean, in and out here and there, but I was looking around like, wow, that's new, or this is new. And then just meeting some of the providers that are new here. I mean, some of the ones that have been here for a long time and have made Titusville home, but to see everybody really buying into the community, and everybody really just has the same goal. It's patient care and getting the best outcomes that we can for our patient. And that was something that really drew to me as I was looking at different options and all that.
I think the other aspect too is you're helping your neighbor, a family member. You're seeing those people that you know and love, and it can be stressful for somebody because when you have that relationship, when you know somebody and they're going through something, that can be hard.
Yeah.
But you can also go home at night going, boy, you know what? Maybe I provided that care that person didn't have. And there's that aspect of it.
Mm-hmm.
So what's that been like for you to kind of revisit those people that maybe, you used to come and watch you play basketball, or to, that supported you through your career?
Yeah, it's funny you said that. I was working up at the hospital yesterday. I spent some time both places just to help out. And I was in with a patient and had to run out and grab a walker for another patient. And I was kind of frazzled, just trying to go get the walker and go back. And I saw this older individual walking with a nursing member, and I hear just in the back of my head like, "Hey, I know that guy." And I was like, I don't know if they were talking to me or not, but I'm coming back up the ramp from our department, and he's like, "I remember you." I'm like, "Oh yeah?" And he's like, "Yeah, you were that basketball player." So it was these little reminders like, yeah, this is home, this is where we need to be. And like you said, just kind of helping out your neighbor. I mean, we had so much help and support growing up here that it's time to give back, and that was the big driver for us.
And as we mentioned, that's really any age, right? That that could utilize those services. So, Kelly, again, eating disorder support group coming up next week, May 23rd, 4 p.m. The day after the golf outing.
Day after the golf outing, yes.
Golf outing. Okay, that's gonna be a lot of fun.
Yeah, it's gonna be a lot of fun, and then. What will I be doing with myself after we get all this?
Getting ready for next year.
Right.
doesn't slow down
it doesn't
for
stop.
you.
No.
If folks have questions, they want more information, maybe somebody just wants to support the foundation. That's a phone call they can make to you guys?
Yes, absolutely. They can call me directly for anything. About the foundation, any projects we're working on. If they want to make a donation, you can make a donation in memory of someone or in honor of someone. If you ever walk through the hospital close to the cafeteria, there's a wall there. It's the Tree of Life, and if you make a donation of a certain amount, you can get a leaf on the tree or a dove on the tree. So if you wanted to do something like that, you can always talk to us as well.
And there's the
yes,
recognition.
Yes, that's our recognition for our oncology department.
Excellent.
Yes. So
Kelly,
thanks so much.
Good to see you. Thanks for your time.
You too.